Welcome to the Spring 2015 PDP Compassion Fatigue eLearn. Remember to press Exit Activity to have the video and quiz credited. During the summer of 2014, several high-profile events brought the subject of first responder mental health into the spotlight. Post-traumatic stress disorder, a once rarely heard term, seemed to be in the news on a nightly basis. Military veterans, police officers, firefighters, and paramedics, mental health issues were being tracked and examined on a scale never seen before. In 2014, the Paramedic Chiefs of Canada, the Paramedic Association of Canada, and the Paramedic Standards Steering Committee each released reports examining and making recommendations around the issue of paramedic mental health. In the Ontario Provincial Legislature, the Liberal government released the results of a 2-year roundtable discussion on job-related traumatic mental stress, and MPP Sherry DeNovo saw Bill 2, her private member's bill, reach second reading. It's in this environment of heightened awareness that we today examine the issue of compassion fatigue. Compassion fatigue is just one of the many health issues that Canadian paramedics and communications officers face as a consequence of the job. We will introduce several key concepts and terms regarding mental health. To help explain and examine these issues, we have enlisted the services of Ms. Françoise Mathieu. Françoise is the CEO of Tend Limited, based in Kingston, Ontario. Françoise is a certified mental health counselor and compassion fatigue specialist whose experience stems from 20 years as a crisis and trauma specialist.
Compassion fatigue refers to the accumulated and profound erosion that occurs over the course of a career or a caregiving relationship, where you are required to be kind of in a helping relationship of a certain way, and over time that gradually can cause a profound emotional and physical exhaustion, because especially when you're seeing a lot of very similar kind of cases day in and day out, it's totally normal that you're not going to feel the same level of compassion for the 500th homeless person that you've seen that has been in the same, or maybe even the same person that you've seen in trouble 500 different times. So at some point we notice this gradual and profound emotional and physical erosion of our ability to kind of engage compassionately with other people, particularly patients, clients, but also sometimes our loved ones. So there is actually a difference between burnout and compassion fatigue, and there's a third term we're going to talk about, which is called vicarious trauma. So burnout can happen, of course, in the profession of paramedics. It can also happen in any occupation. You may have had a particularly unrewarding part-time job when you were in high school, for example. I think a lot of us have been through that, and you may have developed burnout from working there. Burnout refers to cumulative stress, unsatisfactory kind of working environment, poor pay, poor supervision, a bad boss, all of those things. So you could develop burnout from working at Tim Hortons or working at a Goodyear tire factory. You could also develop burnout from working as a paramedic, of course. Compassion fatigue and burnout kind of go hand in hand, and so some of the folks that we see are experiencing more of that compassion fatigue piece, kind of that profound emotional and physical erosion to the large volume of cases that they see, whereas other people, what they're suffering from is more burnout in the sense of frustration with policies, with demands, with workload, with budget cuts, with all sorts of demands of their jobs, with their pay, with their shift or whatever. So you could see how paramedics could easily have a combination of both.
So I get that question all the time in terms of invincibility, or that this doesn't affect me. I deal with difficult calls all the time, and I kind of have two answers to that. The first one, there's a great quote that comes from Naomi Rachel Raymond, who's an oncology physician and talks a lot about physician burnout, and she says the following. She says, "The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet." You can't walk through water without getting wet. You cannot do bad calls day in and day out and not be impacted by it. Now, granted, not all of us are going to be as impacted by the bad calls. There's a whole host of reasons for that. your coping style is a really big one. There's some really interesting research that has been done looking at resiliency and super resilient staff. And so what they did basically is they looked at staff who had been in the field for 20, 25 years and were doing really well. These folks did not have depression, they weren't dealing with PTSD, they weren't dealing with anxiety, and we basically studied them to try and find out what were the protective mechanisms that they had in place. And what we found is that those folks had a daily practice of some kind, something that allowed them to leave work behind. They had a life outside of work. They had a debriefing mechanism that kind of helped them get rid of the difficult calls and kind of move on. And they had social support, and social support was hugely important. And unfortunately, what happens in an atmosphere that's a little bit more like, tough it out kind of mentality, is sometimes we lose that social support because we're all kind of so busy kind of telling everyone that we're fine, and maybe we are, but maybe we're not. So it's a bit of a myth to think that we're not impacted by it at all, but it wouldn't be true to say that we're all impacted in the same way. Some people are more resilient than others. That's actually a fact. That's a pretty common sign of compassion fatigue. The kind of work that paramedics do involves, I think that the common public doesn't really understand what a paramedic really does, and the fact that, what did someone say to me recently? It said something like, 10 hours of waiting, 10 minutes of action, and then 3 hours of paperwork, that kind of idea. And I think that sometimes the nature of the work that paramedics do is actually incredibly routine and fairly repetitive. Now, that might not be true for someone who's not a paramedic. They might be quite shocked by what you do every single day. But you know what I mean, like that there are a lot of calls that are very, very similar, and that you're kind of not getting your blood pressure up. You kind of do it and you're good at it, but it might get at some point to be fairly routine. And that's where actually compassion fatigue can come in, where you become sort of desensitized to certain stories that might actually be quite traumatic or significant to other people. You might come home and tell an ordinary civilian about what you did that day, and you're like, oh, just all in a day's work, and they'd be like, oh my gosh, that's a big deal. The reason that can become a problem is that at some point, if we're too desensitized to the job that we do, we can also numb out. And when we're numb, first of all, there's a couple of risks. One of them is that we actually start missing something big. So we found, for example, that when we're treating patients with persistent mental illness and addiction, sometimes we stop screening for certain things because we've seen them so often, and we kind of become desensitized to their stories. So that's one of the hazards of compassion fatigue, kind of this numbness and desensitization. And the other part is that we can start becoming kind of adrenaline junkies, that we start kind of getting excited when something's really, hardcore. And then we need to kind of ask ourselves, why am I so hooked on that? What is it that gives me that juice, and why is that happening? It's a great question. So first of all, there's a lot of research out there that kind of gives you a variety of stats, but basically on average it's estimated that about 60% of the population has experienced a traumatic event at some point in their life. It varies a little bit for men and women, but just about 60%. So first of all, if 60% of your paramedics are coming in with their own history of trauma, that doesn't mean that they can't be good paramedics, but it means that it's considered a vulnerability factor. And if they have that vulnerability factor, they need to have their ducks in a row. Now, some people have experienced trauma in the past, and that's actually a resiliency skill. It means that they know how to problem solve, and it's going to make them more able to cope with whatever's thrown their way because they resolved that trauma experience and they're good to go. Other people who've had no trauma experiences, and I'm sure some of you have seen that with brand new paramedics who were really sheltered, for example, and they're totally traumatized and shocked because they didn't have that in their kind of toolbox, of resiliency skills. But the reality is 60% of us have some trauma. So is that a trigger for you? Did you resolve that, or is it something that's still hanging over you? Did you become a paramedic because you had a traumatic experience and you were trying to kind of, you know, brings that to resolution. So basically, have you sorted that out for yourself? The other thing has got to do with your current life circumstances. I'm a therapist, so I hear everyone's story, and everyone came into my office for therapy and couples counseling, and I know that the reality, and this actually, I think Yogi Berra said that years ago, he said, we're all bozos on the same bus, right? We're all bozos on the bus, and the reality is that we've got lives, and they're complicated. And so if your current life circumstances are that you're going through a really messy divorce, that's going to interfere, or potentially, not necessarily, but potentially interfere with your ability to deal with something. If you have very young children and you're dealing with calls that involve very young children who've been injured or worse, you're going to have a vulnerability to that. And, you know, I deal a lot with police officers who do child pornography, you know, research and investigations, and a lot of them say that when the victims are the same age as their own children, that's a vulnerability factor. Again, it doesn't mean you can't do this job, but we need to pay attention to those things. How do I cope? Do I have a history of addiction? If I have a history of addiction, do I come back from a bad call and kind of lean on that? You know, so those are all considered vulnerability factors, or conversely, they could actually be resiliency skills.
Anger and cynicism, unfortunately, are quite a common kind of hallmark of what we call trauma-exposed workplaces. Trauma-exposed workplaces are workplaces such as any first responder works in a trauma-exposed workplace. And what we find is a combination of working in a high volume of trauma exposure, regular exposure to kind of difficult stories, individuals in pain, you know, suffering, illness, and so on. Having that combined with you know, less than ideal kind of resources. You know, let's be honest, we're dealing with kind of an economic downturn in Canada, and a lot of places are really being asked to do more with less. And what we find is that sometimes the combination of what we call systemic stress and traumatic stress, which is kind of all that regular exposure to traumatic stories, that combination leads to what Dr. Pat Fisher refers to as complex stress. And complex stress can manifest itself as an increase in cynicism, negativity in the workplace, sometimes, unfortunately, what we call horizontal violence, which is more kind of bullying of each other, more workplace negativity, and a certain amount of constriction, kind of like a loss of creativity, because we're feeling, you know, kind of stressed by the job and also frustrated by the lack of resources we have.
So it's true that PTSD is in the news a lot recently, and that's a good thing. It's a good thing that we're starting to talk about post-traumatic stress disorder. I think that PTSD belongs on a continuum. So the way I'd like to invite you to think about it a little bit, you know, would be kind of going from the green zone to the yellow zone to the red zone. And the green zone would be you are brand new to the field, you don't have a history of trauma, you know, you are fresh, you're keen, and you are ready to go. The first time, you know, you go on a call, you're kind of in the green zone. You're still pretty green and fresh. The yellow zone is where most of us live most of the time, and sometimes we're closer to the green zone. You know, we're doing pretty well, but some of our work has, you know, contributed to some stress. Maybe we're struggling with some elements of burnout or compassion fatigue, but we're still doing pretty well. When you're getting to the red zone, you're starting to get into the danger zone, the area where maybe you're showing some clinical symptoms of post-traumatic stress disorder, or you're showing some symptoms of depression, and that's where you're getting into the place where you could be headed for trouble. It's a continuum, and what we need to do is kind of pay attention to where we're at. So sometimes you may hear some whole list of symptoms, like what is PTSD, what does it look like? And you may say, well, I have some of those, but not all the times. You know, I have certain features of it. So one thing that might be going on for you is that you may not have the full-blown post-traumatic stress disorder, but you may be struggling with what we call secondary trauma. And secondary trauma refers to the repeated exposure to traumatic stories that you experience as a paramedic, which is inevitable. And over time, that can start kind of shifting your view of the world. It can start making you more aware of, you know, safety issues. You know, an example is if you do a lot of roadside accidents, you may become hypervigilant about driving on the 401 because you've seen so many accidents, stuff like that. When that gets to be quite significant, it can turn into post-traumatic stress disorder. So it's a continuum. I agree, it's an awkward topic, and in fact, because it's an awkward topic, unfortunately a lot of us don't do anything. It's a little bit like, I'm going to use a parallel of grief. I'm sure a lot of you have had a friend who lost someone in their life, and a lot of people who experience a loss often say that their phone doesn't ring, nobody calls, you know. And I think that nobody calls, it's not because people are uncaring or unfeeling. I think nobody calls because when you talk to those folks, they're like, I just didn't know what to say. The same is true with mental illness and with depression and burnout and compassion fatigue. We don't know what to say. We don't know how to approach it. It is an awkward topic, so we don't do anything. So the first thing I would recommend is reach out to them. And if you don't feel like you necessarily want to start by talking about this, invite them out for a drink, invite them out for a round of golf, or go for a power walk, or do, you know, whatever it is that you like. Just have an activity so you can spend a little bit of time with them, just hanging out. And I think that it's important to be able to say, you know what, I'm concerned about you. I've noticed the following things. You're not yourself. You know, like kind of more addressing some of the behaviors you're witnessing, as opposed to coming out and saying, I think you may have PTSD. I think you may be depressed. Just reaching out and saying, you're not yourself. You know, you weren't yourself on that call. I'm worried about you. And just realize also that they may brush you off at first because it's kind of part of that, you know, paramedic mentality of being tough. And it doesn't mean, first of all, that they haven't heard you. And I wouldn't just stop there. You know, I would keep reaching out and saying, you're still not yourself. I'm really concerned. But as I said, you know, it's really hard to, you can't make someone get the help that they need. And part of what's hard about depression, for example, is that a lot of people end up isolating themselves. And when you're at a place where you're having a hard time reaching out or leaving your house or getting to work or talking to friends, there needs to be a professional involved, because that's way beyond the scope of what a friend or a colleague can do. And we also need to know our limits. I think the paramedics are also sometimes can risk to fall into the rescuer mode, you know, of wanting to fix and help everyone else. And how do we draw the line where we are not over-functioning to try and help someone else? So it's a tricky balance, but the worst thing you can do is to say nothing because you're feeling awkward. You know, reach out and talk to them. Absolutely. So you've probably all heard a lot about debriefing. We talk about critical incident stress management and all that kind of stuff. What I see a lot among first responders is something that I jokingly refer to as sliming. And sliming is not the same as debriefing. Sliming is when you go into the lunchroom and you tell graphic details to all of your colleagues about what you just saw, you know, on the call. Guess what I just saw? Bleh. And a lot of that of us do that, and it's a form of venting, and it's a form of taking off a load kind of thing, you know, getting it out of our system. The problem with it sometimes, though, is that what we're doing is even though we've heard all these stories before, we're re-traumatizing one another. We're kind of throwing trauma all over the lunchroom. And so what I invite you to do, first of all, is start thinking about what does debriefing really look like for me? What is the difference between debriefing, a water cooler chat, talking, you know, in the truck, pillow talk, talking at a soccer game, and talking over beer and wings? Like, is it all the same? And what we're recommending is, yes, talk about it. Yes, it's important, but there are a couple really simple steps that you could take so that you're not actually sliming your colleagues. And the difference is the following. We call it low impact debriefing. Do you remember aerobics in the olden days, you know, low impact aerobics where you weren't getting shin splints and stuff like that? So low impact debriefing is basically a process where, first of all, it doesn't take long, but first of all, I'm inviting you to kind of think a little bit about self-awareness, like, am I sliming? Maybe you've walked into a party once and you told a story you thought was funny, and it turned out everyone was traumatized, and you're like, ooh, you know, I wasn't self-aware of what I was doing. The second step is asking for permission, and we almost never do that, right? Like with our colleagues, we very rarely go and say, hey, you know, buddy, I just heard I was just at a difficult call, can I tell you about it? What we often do instead is say, guess what? You know, we kind of don't ask for permission. What we also recommend is that you do a little bit of fair warning. If you have to give somebody bad news, right, and I'm sure you actually sometimes have to do that, what do? We say to people, you better sit down, I've got some bad news. We prepare them. If your friend thinks that you're about to talk to them about the latest hockey score, and instead you're sharing with them a really traumatic call, they're not ready to hear that information. So low impact debriefing is really simple. You go up to whoever you need to talk to, you ask for permission first of all, hey, I need to debrief, have you got a minute? And you also give them permission to say no. Like they could say to you, listen, you know, I'm kind of crispy today, I'm kind of in the red zone, could you go tell someone else? And we're going to respect that with each other. The other thing that I encourage you to do is not necessarily start with all of the most graphic details of what it smelled like and looked like and all of that. Start with the Coles Notes and gradually tell them a little bit more, and let them decide if they've heard enough or not. And that's a really different process than having some competition, in a meeting room about who heard the most gruesome and graphic kind of story. Now, I know paramedics tell me all the time that you're tough and you're desensitized and that stuff doesn't bother you. But the truth, again, is that what we're finding is being exposed to traumatic stories over and over again, even if you think you're not being impacted, is actually impacting your brain. Like, we're seeing neurologically that it's having the same impact as people who are exposed to direct trauma. So why not take care of each other a little bit better? And then when you are having a real debrief, then the person can truly listen to you and be there for you. So sliming versus debriefing, just having a conversation with each other about that and how we can kind of improve a little bit on how we're kind of re-traumatizing each other in the workplace. There are some very concrete strategies that you can use every single day. And so this is some real, really concrete take-home message about what can I do today? What can I do? So the first thing I'd like to invite you to do is to pay attention to your physical body. Like, what does your body tell you? What are your warning signs? A lot of paramedics do very physical work, and in fact a lot of paramedics have, back injuries and a whole bunch of other kind of physical symptoms. But even if you don't have an injury, what is your stress gauge? How does your body tell you? Some of us have, neck and shoulder pain when we're stressed. Other people get migraines. Some people get low back pain. A lot of people get GI stuff. Those are very, very clear signals that your body is overloaded and stressed. And there's a huge connection between the mind and the body, as we know. And I'd invite you to literally just pay attention like today and to say, when I'm in the yellow zone, when I'm getting closer to the red zone, does that ramp up? For some of us, it's insomnia. When we're closer to the red zone, we have trouble sleeping. So just charting that for a few days. And if you're not sure, actually ask your loved ones. I'm sure they will actually know what your warning signs are. They tend to be better at that than we are. Another one would be to pay attention to some of our behaviors, some of our actions. For example, a real warning sign of getting close to the red zone for some of us is irritability. I know, for example, and my kids are delighted to tell me this, when I'm close to the red zone, they'll say to me, Mom, like, your tone of voice is harsh. Mom, you're turning into a drill sergeant. I'll come home and I'm like, let's go, let's get breakfast done, And I know for me that that's actually a really simple but very clear warning sign. For some of us, it's actually that we're more distracted, that we're more forgetful, or it could be that you're more emotional, or you're more easily angered, or whatever. There's tons of them, and I talk about them in my book. There's a whole host of kind of warning signs. But paying attention, kind of tuning in to, like, how am I feeling physically? How am I feeling behaviorally? And what's different, when I'm on vacation and I'm in the kind of close to the green zone compared to close to the red zone? How do I look and behave? And we know that there's a difference. And those are ways for you to kind of know that you're headed for trouble. Another really good one, which is really simple, is to pay attention to how you are self-medicating. Self-medication means that we are using some substance or behavior or foods to numb out. So lots of examples, of course, a lot of people self-medicate with drugs and alcohol, but a lot of us self-medicate with food. We'll go home and we'll binge, especially shift workers. I don't know about you, but most shift workers don't crave carrots at 3 o'clock in the morning, right? So we go for sugar, fat, salt, and we overeat. Or a lot of people will abuse the internet, like they'll spend hours watching Netflix. And sometimes that's good, but you know the difference for yourself, right? What's the difference between me watching a show and kind of finding that was a really good relaxation method compared to watching 7 seasons of something? And those are daily practices, right? Those are things that you can pay attention to every single day. How am I doing with this? Self-monitoring kind of thing. The other one I recommend is a transition ritual. I'm sure that almost all of you, if not all of you, when you go home, you change. I really doubt most of you are spending your evenings sitting on the couch in your uniform, right? And so that's a transition, right? And if you did spend the night sitting in uniform, wouldn't that feel weird? Like, wouldn't you have a hard time kind of decompressing? And so we need to have mindful transitions. So maybe your transition is, basically the question is, how am I leaving work behind? What's my ritual for getting home? And maybe what it is that you go home and you walk your dog. Maybe you go home and you roll around the carpet with kids and play with them. Or maybe you go home and you have half an hour of quiet. Or maybe if you don't have a quiet house, maybe it's full of people. Before you get in the door, you actually sit in your car or on a park bench and have a little bit of a 10-minute to yourself to kind of ground yourself back into your, into your own self and transition home. So these may seem like incredibly simple strategies, but I know for myself that this is going to sound incredibly simple, but for me, one of the best ways to monitor how I am is how I take out the garbage. So you're going to think, what? So when I take out the garbage, when I'm in the green zone, I go out and I talk to my neighbors. Hey, how's it going? A little chit chat. When I'm in the yellow zone, I will avoid it. I'll kind of look out and I'll see my neighbors and I'll think, oh my God, I'm going to wait a minute till she leaves so I don't have to chat to her. And when I'm in the red zone, I take the garbage out at night when I can't see anyone. And that may seem incredibly simple, but they're daily activities that make up kind of the feedback loop of where am I at with my compassion fatigue and my burnout. It's not about necessarily taking some huge medical, every 6 months. It's about the daily stuff where you can kind of say, hey, am I on a slippery slope? How am I doing today? It's true, but the things that you have that are the same are your vehicle, your uniform, getting dressed, having a shower. There are a lot of rituals that are the same every single day, no matter whether you're a shift worker or not. Now, granted, being a shift worker is harder. There are some gyms now that are open 24 hours a day specifically for that reason, but it's harder. It's harder. We know that shift workers don't eat as well. They don't exercise as well. They actually have a shortened lifespan, just to be really cheerful about this, but we know all of that. So what you need to do is you need to build a daily practice that has to do with the rituals that you have of transitioning home and to work. So you get up, you have whatever meal you have, call it breakfast, no matter what time you're getting up. Are there some things that you can associate with that practice? There's something really simple that maybe you've seen that's called the 7-minute workout. And it's actually an app. It's called the 7-minute workout app. It's free. And it's basically 7 minutes of physical exercise. It kind of, forces you to do every kind of body part, like, push-ups and all that kind of stuff. And although that may sound really simple, first of all, 7 minutes is actually realistic and achievable for all of us, pretty much. And having a ritual like that where you're going to do that at the end of your day. So again, even if you're physically exhausted, physical exercise is one of the best ways to flush out your stress hormones. That and drinking lots of water. So is there something like that you could build into your day-to-day, ritual? I finish my shift, I do the 7-minute workout, I go home and have a shower. So kind of building in those types of rituals, no matter what kind of crazy shifts you work.